Laura and I are data journalists, and we specialize in analyzing data and telling stories with it. And over the coronavirus pandemic over the last 9 months, we decided to put our skills to analyzing some of the data that was being made available, mostly as a public service. We did it for free, but we learned a lot of lessons along the way, and I think we were kind of overwhelmed by the response to the coronavirus dashboard, which we thought was overly heavy in terms of data, but it got a huge uptake. So we're going to talk a little bit about the kind of process that we went through and some of the trends that shaped the pandemic in South Africa. And Laura's going to start off with that, and I'll come back with a couple of lessons that we learned at the end.
Why do people turn to data in a pandemic? I mean, for every day for the past year, the National Department of Health has been releasing an infographic that gives us information about how many people have been infected, how many people have passed away, and how many new cases we have every day. And people have shared this on social media. They've talked about it on WhatsApp. The latest infographic from Friday, the 27th of November, shows us that South Africa has 781,000 people who've tested positive for the virus, and we've lost just over 21,000 people to the virus. And from the day before, our daily increase is just over 3,000 cases. And also, this graphic can show you that Gauteng has the most cases and the most fatalities. But imagine if that was the only data that you got. If these were the numbers in this graphic was the only information that you could get. For example, it doesn't tell you whether South Africa is getting better or worse in terms of the outbreak numbers. It doesn't tell you how we compare with other countries. And it doesn't tell us where the hotspots are in South Africa. I don't remember a time outside of an election when people have been this interested in numbers. They even go searching online for them, looking for more. Why? Because these numbers tell the story. They tell a story of what's happening in South Africa with the COVID-19 pandemic. And this story helps people to make sense of what's going on. How do we know this? Well, because we built a dashboard, Alastair and I, in March, using the official numbers that are released by the National Department of Health. And since, in the 9 months since that dashboard was released, we've had more than 800,000 people coming to visit us. A lot of those people visit us more than once a day, or at least every day, sorry. And they sent us, they've got in contact with us. They've sent us emails, they've made suggestions, they've asked us questions, and a lot of that interaction with people, a lot of that feedback has fed into what our dashboard looks like now. We've built a community around this dashboard, and we can and we can see what the data's told us by watching what's happened over the course of the last 9 months. I just want to show you a slide. Right at the beginning of the pandemic, most of the people who were infected had been traveling from other countries, mostly from Europe. We made a map showing what the National Institute of Communicable Disease showed us, where they came from. But by the 15th of March, the first local transmissions had started. And that was when the president declared a state of disaster. And most of the people were confined to their homes. So the data not only told us what was happening at the time, then the daily case was about 110 a day. But the data also helped us set milestones. If you look at this graph, you can see that the number one, that line where number one is where the first lockdown level, the hard lockdown started. And you can see it was very, very early on in our pandemic. We had no idea what was to come. Even though this lockdown was very early on, at the time we had no idea what to expect. So what was useful about the data as well is it helped us set milestones so that we could see where we were going. And one of them that I think is a good example was Prof. Salim Abdul Karim, who is the chair of the Ministerial Advisory Committee, gave us a target during a televised broadcast where he said, if on the week of the 6th to the 13th of April, the average number of daily cases stayed below 44%, we would ease the lockdown. So we started to track this on our dashboard, and unfortunately, the average cases were 96, and that meant that the lockdown was going to be extended. So we were able to show people, things were not as good as the scientists wanted by putting it on the dashboard and letting people see how we were doing. So looking back now, you can see that lockdown, the first lockdown, the hard lockdown, was imposed very, very early on in the pandemic. And if you look at where our peak happened, which was in mid-July, I think you can safely say that lockdown actually did do what I think it was intended to do, which was to prepare us, was to slow down the wave of infections and prepare our healthcare system for what was to come. And that was in mid-July. By that time, there were 12,000 on average cases a day. And it lasted for probably about 2 weeks where it was really bad. And then it started to drop off in August. In September, October, we've had it relatively easy. It's been 1,500 cases a day. At the peak of our infection, we were one of the top 5 countries in the worst hit countries in the world. Now we're down to, I think it's 16. In terms of daily cases, it's 36. But I think that what's clear from this chart is that we actually can't just assume that the worst is over. We weathered the storm. I think that this chart shows us that our healthcare system weathered the storm. We lost over 21,000 people, and many, many people, because of lockdowns, have lost their jobs. But it could possibly have been worse if we didn't take the precautions that we did earlier. I think what is interesting to look at is the way that the numbers are starting to rise again at the moment. The data is showing us that we have to be careful. I want to finish off with a chart just to show that even though the national numbers look like they're rising, it's important to look down at provincial and district level data. In South Africa, this is where our problem lies. The district level data is not released by the National Department of Health. It is released by the individual provincial governments in 9 different ways. They all have their own way of doing it. And it's released generally as infographics and on social media and very intermittently. So you can't follow what's going on. If you look at this chart of the provinces, at the moment, the increase is actually focusing really on the Eastern Cape and a little bit in the Western Cape. But if you had to really dig into the district data, if it was really available, you would see that actually the hotspot in the Eastern Cape is Nelson Mandela Bay. If we were able to have access to that information, it would, I think, we would be able to chart it, and it would show people where the risks are. I think that the difference in the accessibility of this data, the district and the national data, shows something very important. Good data instills confidence. It gives people a sense that the authorities have the measure of the problem. It gives people a sense that we're in control of this pandemic. And that's why making this data publicly available is important. I'm going to hand over to you, Alastair. You can carry on with the importance of publicly available data.
Of course. So throughout this process, we've learned a number of lessons, important lessons, I think, and things that I think that we need to bear in mind in possibly future pandemics. Unfortunately, we probably will face those. But as Laura says, having accessible data and reliable data, which is available to the public, tends in general to instill trust in the authorities and in that data. The problem that we had prior to people like ourselves doing dashboards is that, as Laura pointed out, is that each day a single number was given out. So many people had died, there's so many cases, but there was no context in that. And in the absence of that kind of context, people tend to start imagining what is actually happening. And we saw this very early on. There was this initial little spike, which in retrospect was a very small spike, but at the time people were seeing these big numbers and were imagining that this was significantly worse than it really was at that point. Fortunately, that was only a very small blip at the beginning of the lockdown. So in the absence of reliable data, people tend to kind of imagine things or come up with their own conspiracy theories about what's true and what's not. And we saw a lot of this during the early stages of the pandemic, where people started to almost distrust the authorities because it was one day the number was this, the next day it was this, and it was significantly different, and there was no sense of progression or any kind of a context that allowed them to see that this was going up or down, or, as Laura says, that it was affecting certain regions over other regions. I think the problem in that is that the lessons that we probably need to learn out of this is that we can't manage something like a pandemic through a kind of process of fear. So saying, if you go outside, you're probably going to get sick. At worst, you may even die. You can't manage that effectively because at some point that gets overstated and people start to distrust that, or they have experiences which differ to what you're trying, the message that, in this case, government would be trying to put out. Rather, we need to be managing pandemics and issues like this by utilizing what is essentially public data to inform people so that they can make their own decisions. And I think our experience with the dashboard is that was the biggest thing for most people was, what is the context? How is this changing? Is it going up? Isn't it going up? Are these numbers reliable? By making data publicly available, I'd like to call it almost like peer review. Although it's not peer, it's giving it to people so that people can actually interrogate that data. And we saw this repeatedly throughout this process of coronavirus. Data would go out, we would publish it, and we'd have people responding to us going, why is this like this? Why is this number changed so radically? Why does this look incorrect? And that's an empowering thing because it actually gives people the opportunity to interrogate the kind of information that's been put out by public officials and make their own decisions about it, and perhaps even feed back into a process where now we are able to say, and in many cases we went to certain provincial departments and said, like, why does this not look right? What is missing in this data? Currently, there's a good case in point. Gauteng provincial government has stopped releasing active cases and recoveries, the recoveries and hence the active cases. They've stopped releasing it. And even before that was announced by the national department just a few days ago, we had people contacting us going, why do these numbers in Gauteng look wrong? What's going on here? Something's not right. I'm not suggesting that we necessarily had caused an investigation into that, but certainly people were already picking up on it before the provincial government had actually ordered the Gauteng provincial government, national, had ordered the provincial government to actually interrogate that. So it's a very empowering thing, and it allows people to build, to understand the data and the context that they live in. I think in general, South Africans reacted very well to the pandemic. I think people did the best in most cases to actually limit their contacts to work with it. Clearly not everyone, but in most cases do. But I do think that, and we certainly weren't the only people trying to publicize this data, but I think the more data out there, the more people were empowered to make those decisions. Because at the end of the day, this is public data, and it is their lives and their families' lives that are at risk. And we need to understand that. But I mean, I think at the end of the day, the one big lesson for us in many ways is that and this is probably a little bit harsh, but a lot of the media didn't actually address the core questions that a lot of people had. People wanted to know very specific information about where they lived, how it was affecting them, and having simply reporting on the national level on a daily basis, saying nationally, as Laura says, certain regions stand out as hotspots in this thing. So having the data being released at a national level, just with a single figure that encapsulated the pandemic in South Africa, was largely insufficient in many cases. In the early stages of the pandemic, for example, the Western Cape was seen as the one major hotspot. The reality is it wasn't the Western Cape as a whole. It was Cape Town, or portions of Cape Town, that were significantly hit. Currently, we're seeing, as Laura said, the Eastern Cape is a hotspot that's picking up again. Again, it's not the whole of the Eastern Cape, it's Nelson Mandela Bay. So that level of information, it needs to be more granular than just a single digit or a single number to cover an entire country. That was insufficient. And I think the lesson in that for us, particularly as we do come from a journalism background, was we need to be doing a better job of answering people's questions. Our readers and the people that look to us for information want specific kinds of information. They don't want regurgitated things that they can get anywhere else. They actually want actual answers that affect their lives. So there were a number of lessons within this entire process, but certainly the need for information to combat a pandemic was the first and foremost one. The other one was that people are drawn to data if it's presented in a certain way that helps them understand what's happening in the world around them. That was very important. And also that there's a community of people that want to engage with this data and want to actually feed back or have some input on that or ask questions and actually push it forward. So there were a number of elements in that, but at the end of the day, these are charts, and these charts are bars and they're lines, but they actually represent people, and they represent people's lives, and they actually represent the impact of the pandemic on a country like South Africa or anywhere else in the world. And at the end of the day, we need to remember that. So we do the charts as a way to try and explain how this affects people in a very real manner. I think that's pretty much kind of the work that we've been doing. Mm-hmm. It's been both rewarding and enlightening. And certainly I hope we don't have to do this for much longer, but we continue to do it. I'd like to see the end of the pandemic. I'm sure we all would. But until we can get a handle on the current kind of increase, it looks like we could be doing this for a little while longer.
Yeah.
So I think that's us.
Thank you.